This video is going to give a really broad overview of disease classification. So there's a lot of ways that people can get sick, and basically there's ways that we subcategorize those illnesses, and there's even ways to subcategorize those categories. So I'm just doing a really broad overview, and there's a lot that I'm probably going to miss, but these are basically the broad categories of disease. So infectious diseases are what comes to mind for most people, and that's subspecified by the type of agent. So like bacteria, like the bubonic plague, and viruses, parasites, fungi, and also other uh, kinds that don't fit there. So things like protists and prions. It can also be specified by not only the agent but the part of the body that is affected. So if it's affecting a specific organ, it might be considered a separate disease than if the same bacteria or virus was found elsewhere. Neoplasms is a broad category that encompasses all cancers, and it's typically subspecified by where in the body you have cancer and how severe the cancer is. Diseases of the blood and blood-forming organs are their own category. So some of the more mild and common ones are like anemias. So that's not like an iron deficiency, not having enough hemoglobin, that kind of thing. But also structure and function of red blood cells, things like sickle cell anemia, disorders to do with clotting like hemophilia, and disorders affecting the spleen. Diseases of the immune system are a separate thing where although immune, basically white blood cells and stuff, also show up in the blood, the function of the blood in general, kind of as far as the blood cells and that basically is distinct enough from the immune system that immune diseases have their own broad classification of immunodeficiencies. So that's basically when your immune system is unable to protect you. Either you're not producing enough of these white blood cells or other parts of the immune system, they've been destroyed in some way, what HIV and AIDS does. There's also autoimmune diseases where you basically have an overactive immune system and it starts attacking your body, basically, which is kind of similar to allergies, where it's not necessarily that you're attacking your body, but it's basically a consequence of having an overactive immune system, where instead of attacking your own body, basically it's just responding disproportionately to the threat, where a peanut's not really a threat, but your body is responding so severely that it's hurting you way more than the peanut ever would. So now there's endocrine, nutritional, and metabolic diseases. That seems like a really broad category that I was kind of wondering why they didn't subclassify this, but I kind of get it, where they're all related in the sense that endocrine disorders are a lot of the hormonal disorders and glucose regulation. And glucose regulation disorders are things like diabetes, which is heavily related to nutritional disorders like obesity, and deficiencies isn't as related to that, but yeah, basically it's a spectrum in that sense. And also metabolic disorders, like those associated with whether you're able to uptake and transport metabolites, and your ability to maintain the salt balance in your blood, stuff like that, all kind of gets grouped into one category. So mental, behavioral, and neurodevelopmental disorders, there's a lot of them that don't group terribly nicely, psychotic disorders, things like schizophrenia. There's also mood disorders, things like bipolar, the various eating disorders that includes overeating and undereating, various addiction disorders, cognitive disorders, so I guess things to do with memory and your ability to basically think, and also anxiety. And there's a lot more than this, but basically this is a category of its own. Sleep-wake disorders, that includes sleeping not enough, so the inability to sleep, like insomnia, sleeping too much. So I guess hypersomnia would also include narcolepsy, kind of falling asleep without warning. Also movement disorders like sleepwalking, and things that problems with circadian rhythms. Diseases of the nervous system is distinct from the one I was talking about earlier that was mostly diseases of the mind. This one is more physical in the sense that it encompasses Movement disorders, things like Parkinson's, and I imagine MS is probably in there too. Diseases of the spinal cord, disorders of consciousness, so being in a coma, seizures, things like epilepsy, and the various cognitive disorders that are more structural problems, things like Alzheimer's and dementia. I think the cognitive disorders that were part of the, basically they were part of like the previous category, I think is somehow more like mental illness related as opposed to like structural issues and breakdown of the brain tissue, like with some of the cognitive disorders that happen with age. Diseases of the visual system gets its own category. Visual impairment is the most common one, but there's also ones that aren't so much to do with like the lens and the ability to see. It's more like the physical structure of the eye. So things like glaucoma, that's like a buildup of fluid where it's being produced at a higher rate than it's being discarded from the eye. And just diseases and of the eyelid and basically the area surrounding the eye. The anterior and posterior eyeball have very different roles, where the anterior part is where all the light and basically like honing of the outside world into an image occurs, while the back part near the retina is kind of all about transferring that visual information into something the brain can interpret. And so I guess they have such distinct roles that their disorders are their associated diseases are subspecified, and colorblindness fits in there somewhere as well. Diseases of the ear and mastoid process, so that's just kind of like the jaw, I imagine. To be honest, I don't know, but yeah, the ear. Basically, they separated physically into like the outer ear, inner ear, and middle ear. This encompasses vestibular disorders, where that has to do with like the basically there's like a series of tubes in your ear that are responsible for your balance, basically. Where I guess the way water or liquid, not water, but the way liquid is oriented in those tubes gives your body a lot of information about whether you're upside down or lying down and stuff like that. And disorders with that can cause severe dizziness, especially when what your eyes are seeing doesn't align with what the vestibular the vestibular system is saying is happening. This also encompasses hearing impairment. Diseases of the circulatory system, so that kind of encompasses like all veins and arteries, the heart, and to some extent the interface between the heart and the lungs. So pressure disorders, things like hypertension or hypotension, just disorders with blood pressure. Ischemic disorders are all about basically not oxygen-rich blood is not getting to certain places. That is basically how a heart attack happens, is like there's like a clogging of a major artery that's feeding the heart, and it basically is no longer getting oxygen. Valve disorders, so disorders of like valves are all about blocking and permitting blood to go certain places, and it's a very intricate system where like when you close off a path, it builds up pressure and shoots blood on a different path, and when those valves aren't functioning right, that can be an issue. It's subcategorized into disorders of the veins. Things like the disorders of the veins are often about like the inability of the veins to effectively get blood back to the heart, because like when the blood's going through the arteries, it's at very high pressure, and it's like basically like going down from your heart to your feet, because like when you're standing, your heart's pretty high on the list of organs, like physically, and it's got a lot of force going down, but as veins are bringing blood back up from your feet, it's a lot more work. Like you're further from the source of the pressure, and basically, you can get like varicose veins if you stand a lot. And artery disorders are more to do with like plaque buildup is what it comes to mind for me, and disorders specific to the lymph nodes. So that has like that is basically, it has to do with the immune system, as well as maintaining like how much water is around. So diseases of the respiratory system is what's next. It's separated physically into like things that are kind of more around like the mouth, like tonsils and sinuses, and lower respiratory system, like your classic like emphysema, asthma, infections of the lung. So pneumonia is a really common one. basically, I guess, like pressure and water regulation around the lungs, so like pulmonary edema and just failure of the lungs. The diseases of the digestive system are very much separated by where they are on the path. It's a tube basically, and it has very distinct parts that have very distinct jobs as far as like where different things are broken down, where different things are absorbed, and yeah, basically which part of the digestive tract is being affected is a very convenient way to classify disease. Diseases of the skin was a weird one when I was going over it, just because like mostly the various subcategories are ways that it is like overlaps with other categories. So like remember how we had like infectious and infectious disease? Like a category of the skin is infectious, like skin disorders. There's nutritional and metabolic stuff, that was its own category, but basically there's like skin diseases that are a consequence of this, and pregnancy associated diseases coming soon, but yeah, like skin disorders associated with that. So the skin categories basically are just where the skin diseases overlap with the other categories. Diseases of the musculoskeletal system. It's classic to group muscles and skeleton, even though there's so many distinct diseases that only affect the bones or only affect the muscles. It's just kind of like they rely on each other so much that they're grouped in as one system. So basically, arthropathy, or just like the various like diseases of the joints, like arthritis, spine disorders. So not spinal cord disorders like we were talking about before, but disorders of the actual like spine. Disorders of the soft tissue. So pretty much that encompasses like all muscle disorders and all osteopathies, which is just all bone disorders. Diseases of the genitourinary system. I feel like it's like urogenital. I don't know, but it has a basically just like genitals and urinary tract. Yeah, basically subcategorized by like female and male system, things affecting the breasts, and also things affecting the urinary tract, like urinary tract infections. Sexual health conditions like arousal disorders, that could be too much of it or not enough. Gender incongruence, which I imagine learning a lot about. And also pain disorders, like things to do with sex that shouldn't hurt, that are hurting, basically. Diseases of pregnancy and childbirth. So that's categorized into like things that have to do with abortion, things that are causing it. I guess it's fluid regulation during pregnancy is a big enough issue that like things that have to do with blood pressure and edema are their own categories, similar with bleeding. Maternal fetal disproportion. I hadn't thought about that being a big thing with humans. I know that it's a big thing with farm animals, where like you got to be really careful what cows and bulls you're mating, because if it's like a small cow and a big bull, it's possible that that baby might not be like, that calf might be too big for the mother to give birth naturally. And yeah, like labor disorders and delivery disorders. Diseases of the perinatal period, it's a little more like baby centric here, as opposed to diseases of like pregnancy and childbirth. And they're categorized into things basically affecting the newborn baby due to the mother's physiology. That's things like, I guess, the mother's immune system attacking the baby. Disorders related to length of gestation, I guess that's like too early or too late giving birth. Injury to the baby during birth, and also neurological disorders that are a result of like pregnancy exposures and stuff. Developmental anomalies, some are really common, some structural ones like cleft lip and cleft palate that they're really pretty routine to fix. Some cognitive developmental disorders we're learning a lot more about, and we like things like autism we don't fully understand yet. And chromosomal anomalies, there's not a ton you can do for that. It's things like Down syndrome. It's it's a sad developmental anomaly. Injuries and poisoning. That's. I feel like again those could be two separate ones, because like I feel like as far as what a hospital deals with, injury is a huge one, I would think, or at least like the emergency room. But yeah, injury, obviously you can really separate it by, that says mostly, I think it's supposed to be mostly. But yeah, it's basically subspecified like into really every individual part of the body, broadly specified again by like what has caused the injury. So like things like burns, whether that's like from fire or chemical burns, and also foreign body, so it's something stuck in you. And poisoning is basically subspecified by whether it came from like something medicinal, like a medication or like an overdose, or some noxious substance that humans like shouldn't be coming into contact with.